Hi everyone, it is my pleasure to meet you all in this video lecturing. Myself, Professor Semmalar, Department of Medical and Surgical Nursing, Sri Balaji College of Nursing is going to discuss this video lecturing. So today my course name is Medical and Surgical Nursing 2 and my topic is disaster management. So let us begin this disaster management by giving the brief introduction. Introduction. A disaster is a situation in which the community is incapable of coping. Even now, we are sitting with this COVID-19, and this is a major disaster what we face worldwide. And also, it is a natural or human caused event which causes intense negative impacts on people, goods, services, and the environment, exceeding the affected community's capability to respond. So therefore, the community seeks assistance, government and international agencies. So here, the international agency is Red Cross and the Red Crescent National Societies, supported by the International Federation, work with the communities to reduce the risk and mitigate the effect of prepare to respond and recover from disasters. The first people to respond to a disaster are those living in the local community, as we all know. So whatever disaster, whether it is a natural or man-made disaster which is occur, the first response given by our local people are from our community only. So this is the International Federation. They only started the first relieving activity worldwide. So they have some credentials. Let us see this one. So here, if it is any disaster is occurs, so preparing for disasters and how we are responding to the disaster, only it will make us recover from the disaster. Whereas reducing the risk of disasters also leads to reducing the risk of disaster. Whether it is reducing the risk or preventing, definitely it will lead the community people will relieve from the disasters. And here, the definition about the disaster is a natural or human caused event which causes intense negative impacts on people, goods, services, and the environment, exceeding the affected community capability to respond. So because of the disaster, people and the things and the services and the entire environment will be collapsed due to the disaster. So here, the disaster management can be defined as the organization and management of resources and responsibilities. It is not like any other illness or critical that we have to act. So this is little different from the diseases. Since the disaster, we have to work in a organized manner and preparedness should be there, and how we are responding to the disaster as well as how we recover also is very important in the disaster management. And here in India, we have a Disaster Management Act. So this is a very good system we follow. So the Disaster Management Act was passed by the Lok Sabha on 28th November in 2005 and by the Rajya Sabha on 12th December 2005. It received the assent of the President of India on 9th January 2006. So this NDMA, we call it in a short form. The act calls for the establishment of a National Disaster Management Authority, that is NDMA, with the Prime Minister is the chairperson, and with that Prime Minister there is not more than 9 members at a time, and including a vice chairperson, and the tenure of the members will be not more than 5 years. So the Prime Minister of India and the chairperson along with their members and their tenure is 5 years in India we follow. Here the NDMA, which was initially established on 30th May 2005 by an executive order and was constituted under Section 3 of the Disaster Management Act on 27 September 2005. So the NDMA is responsible for laying down the policies, plans, and guidelines for the disaster management. So mainly the NDMA focuses the policy making and the execution and what are all the guidelines to be followed during the disaster management. So the main focus is that one only. And then the disaster management plan. So as we all know, on the 1st June 2016, Pranab Mukherjee, the ex-president of India, launched the disaster management plan of India, which seeks to provide help and direction to government agencies for prevention, mitigation, and the management of disaster. So this is the first plan nationally since the enactment of the Disaster Management Act in 2005. Here, the National Disaster Management Structure, what we follow is given as a flow chart. So, Government of India is following three major hierarchical authority. One is the Niti Aayog, and then, as we said before, NDMA, and then NCMC. So under the NDMA only, that the Union Home Secretary and National Disaster Response Force will come, and again that divided, giving power to the state, union territories, and the government, state governments, and then Chief Secretary will be the acting person, and the state disaster response force will be there. Now these state disaster response will giving power to the district, and then district magistrate, and then coordinate with the fire service and state police, and also home guards and civil defense. So, and then after that district power, it goes to the local bodies and authorities. So they will be having connection with the community. So again, the reverse goes back, the community people will have with the district, and then district will go to the state, and then it comes, the flow chart comes in that way. So this is what the Government of India follows nowadays for the any disaster management act. So now disaster is not common for India. It also global, worldwide. Many of them are facing the any one of the, whether it is a natural disaster or man-made disasters. So here the globe shows three colors. One is the blue, yellow, and red. So the blue color gives the economic loss, how much the nations are facing, and then the yellow color, it is categorizing into 5th and 7th percentile of the low economic risk distribution, and the highest will be the red in color that goes beyond 8th and 10th percentile. So now we can identify which nations are falling under the red color. By that we can able to assess the how much the global hazard proportional to the economic loss for the each countries. And then this is about India. So here in India, this map clearly shows in which year, which state that what are all the natural or human-made disasters have been occurred like that. So first let us discuss from the top level. So first Jammu and Kashmir, as we know that by geographically it is more prone to get the earthquake, and also it got during October 2005 and then February 2005. So coming down to the Gujarat, there will be earthquake, as we all know, in 2001, and many people were died, and many of them lost their life on goods, and all the everything is collapsed. So in Maharashtra also, if you see 2005 flood has occurred, and then September 2093 earthquake. So like this, all the state have been by geographically they are risk for some of the natural disaster. For example, Kerala, Andhra Pradesh, and Tamil Nadu are more prone to get to the tsunami since it is located near the Andaman and Nicobar. This one, and Orissa also super cyclone during 1999, and then tsunami, as we all know, in December 2004, there is a earthquake under the sea in Andaman Nicobar. The waves, tidal waves, has affected the Tamil Nadu and the other states also, as we all know. And by geographically also now BIHER, Bhopal gas disaster in Madhya Pradesh, and again coming to Delhi, earthquake 2 times, one is in 1991 and 1999 also, and then there will be a flood in Assam. So these are all the geographical manner how the India has been spread all over the disaster, whether it is a natural or it is the man-made disasters. So next will be, we are going to discuss about the types of disaster. So as we all know, there are two types is the major natural disaster as well as the man-made disasters. So under the natural disasters, there will be a major as well as minor. And for major, flood, cyclone, drought, and earthquake. And for the minor disasters, cold wave, thunderstorms, heat waves, mudslides, and storms. So coming to the man-made, here man-made also there will be two things is there, major and then minor. Under the major man-made disasters, setting of fires, epidemics, deforestation, pollution, and wars. And then for minor, road or train accident, food, riots, poisoning, industrial disasters, crisis, and environmental pollution. So these are all the two types of major disasters, natural as well as the man-made disasters. Coming to the natural disaster, actually here if you see, there will be a adverse event that result from natural process of the earth. So here the earth maybe can go for geophysical disaster or biological or meteorological or hydrological or climatological. So first if you go for geophysical, so there will be a earthquake, volcano, landslide, dry, and then rockfall. So these are all comes under the geophysical disaster. Under the biological, epidemic, infectious disease, and insect bites. So now whole world is facing this biological epidemic, that is the coronavirus, as we all know this one, biological disaster. Next it is the meteorological, so local storm, tropical and extratropical cyclones, and tornadoes. Next it is a hydrological, which is related to water, and we know tsunami, flood, hailstorm, landslide wet, and rockfall wet. And last one, it is a climatological. So here we are, as we all know, that global warming is occurring. So there will be, the scientists are expecting there will be a 1 degree to 2 degree, the temperature will be increased during this decade. So here this changes also will affect the our earth. So it produces a heat wave and cold wave, drought, and forest fire. So these are all the natural disaster based upon the natural process of the earth. So next it is the, so these are all the, some of the picture will gives the clear idea about how we, so drought is there, forest firing, so there will be a flood as well as the landslides, tsunami, and then so these are all some of the pictures to for your reference. And then this is about the hurricane, severe storm, flood, wildfire, landslide, drought, and the diseases, that comes under the biological, and the earthquake again comes under the geophysical, and then volcano, and then tsunami, and terrorism. This again coming under the man-made disasters. Man-made disasters are the major will be train accident or derail, and then aviation incident, that is plane crash, and then shipwreck accident, ship accident, and then traffic pollution, road accidents, and structural collapses, the building collapse, and bridge collapse. So this is forest fire. So this is the plane crash, and then this is also a building fire. So these are all the some of the things man-made disasters will happen in the earth. And then the main thing is here is a disaster cycle. So whether it is a natural disaster or it is a man-made disaster, the important thing is the disaster management. So before going detail into the disaster management, so little brief about the disaster cycle, and which is more important. So here if we take this picture, we have 4 phases. One is a response phase, another one is the recovery, another one is the prevention, and last one is the preparedness. Actually, it starts from the preparedness. So preparing ourselves to face the disaster. So now here, let us discuss with the one best example now we are facing is the coronavirus. So the preparedness of the nations and the individual and the society to face the COVID-19. So that is a preparedness, so pre-disaster activities. So next it is a response. So under that response, there will be a emergency management. So how we are reacting to the COVID-19. So what emergency management we are giving for the COVID patients, and then what infrastructure and services we restore to keep them as a response. So here is the recovery phase, and then reconstruction, and then will be the prevention. So the prevention will be the risk assessment and planning. Here, under the risk assessment and planning, here if we take this example COVID, so what first we are identifying who is the risk people. For example, those who are having low immune system, the children and the old age people, and those who have comorbidity like hypertension, diabetes, cancer, and any other diseases. So this assessment we have to make, and we have to plan according to the risk. So here, so preparedness, response, recovery, and then prevention. So preparedness and preventions before the event, and the response and recovery will be the after the event. So what we are going to do before the COVID-19 and after the COVID-19 has occurred. So this is about the disaster cycle, which is important in the disaster management. So here we are going to discuss about the 4 phases of disaster management. So here this is also an important thing. The 4th thing will be the mitigation, preparedness, response, as well as the recovery. So first it is the mitigation. So what is the mitigation means? So what we are taking effort to reduce the effect or risk associated with the hazard. So some hazard we are expecting something, but as a nation, as a healthcare professional, or as a government of India, or from the health department, so what are all the efforts we are taking to reduce the risk associated with the hazard? So COVID-19. So what efforts we are taking to minimize the risk or to minimize the transmission? That is the mitigation. Next, it is the preparedness. Now, so what are all the actions is taken prior to the emergency facility response and promote the readiness? So suppose COVID-19 here, if we take that example, so what are all the emergency facilities we have arranged in the hospital setting, as well as in the home setting, as well as in the community setting to promote the readiness? And next it is the next step will be the response. Okay, here continuity will come last, and then response. So now action taken during an emergency to save lives, and then property and the environment. So this is the response by the ourselves, individual or society or whatever it is. And then recovery. So action taken after the emergency to restore or resume the normal operations. So now what are all the measures or interventions we are taking? So after the emergency to restore the or resume the normal. So under this continuity, whether action is protect the campus mission from the disruption, continuity, influences to all 4 planning phases of emergency. For example, now if we take mitigation, we should continue with that. And preparedness, response, and recovery. So whatever the actions and the efforts it is made, and that to be continued till the end of this scenario. So this is the important in 4 phases of disaster management. So next important thing we are going to discuss under the disaster management is triage. So this triage is what means the principle of first come, first treat is not followed in mass emergencies. So the processing of determining the priorities, patients, treatment based on their severity. So it consists rapidly classifying the patients as per the severities as high priority and low priority. So here in triage system, we are not treating first those who come first serve, not like that. So we are treating the patient with priority, who is need more care, who needs less care. Now, small introduction about the triage. So triage is the process of prioritizing patient treatment during mass casualty events. Patients are classified according to the type and urgency of their conditions to get the right patient to the right place at the right time with the right care provider. So this is about the introduction about the triage. So we are bringing the right patient to the right place, right time, and right care provider. So triage meaning. So this word has come from French verb trier. This means to separate, short, shift, or select. So we are sorting them, or we are separating them, or we are selecting and shifting the patients according to the high priority and low priority. Next, it is the definition about triage. Is a process of determining the priority of patients' treatments based on the severity of their conditions or likelihood of recovery with or without treatment. So this rations patient treatment efficiently when resources are insufficient for all to be treated immediately, influencing the order and priority of emergency treatment, emergency transport, transport destination for the patient. So this briefly it is explains about the triage. So next it is the triage history. So here actually it is first invented by the Dominic. So during the Napoleonic Wars. So who treated the wounded according to the observed gravity of the injuries and not in the form of rank or nationality. And though the general concept of prioritizing by prognosis is foreshadowed in 17th century by Egyptian document. So here during the Napoleonic War only this prioritizing the patient has occurred in the regardless of their rank or nationality. And then the triage was used further during World War I also by French doctors treating the battlefield wounded at aid stations behind the front. So those responsible for the removal of the wounded from a battlefield or their care afterwards would divide the victims into 3 categories. But that time they did 3 categories, but now we are dividing into 5 categories. That is the types of triage. So one is a simple triage, and then advanced triage, and continuous integrated triage, and the reverse triage, and under or over triage. So here the types goes little more detail. Simple means it is usually a scene of an accident or mass casualty incident. And then tags. So the triage tag is the prefabricated label placed on each patient according to the color. Next will be the advanced triage. So in advanced triage, especially trained doctors, nurses, and paramedics may decide that some seriously injured people. And fourth one will be the reverse triage. So usually the triage refers to the prioritizing admission. And then last one will be the under triage or over triage. So this here, the small difference will be there between under and over. Under triage is the estimating the severity of an illness or injury. For example, priority 1 means immediate, priority 2 means delayed, priority 3 means minimal. So whereas over triage is priority 1 means minimal, priority 2 means delayed, and priority 3 means minimal. So this is about the under and over triage and the triage tags. So here New York State uses the smart tag, whereas the advantage will be the alerts the provider to priority, prevent retriage, and tracking system will be available here in smart tag. So now here will be the how are you going to priority? Giving priority according to the condition. Here, catastrophic hemorrhage. Suppose the patient in the disaster situation, imagine in the disaster situation, the patient is lying down. So we are assessing catastrophic hemorrhage. So if it is a yes means definitely it will be a priority 1, that is red color. And there is no hemorrhage, patient is walking. Yes, walking means priority 3. And then breathing we have to assess. So if it is no breathing means then we have to assess, then we can declare as a dead, that is black color. And then suppose breathing is there, yes, and we are next will be respond to voice. If respond to voice no means, then there will be a priority 1. And then it is respiratory rate 12 to 23. If yes means there will, then we have to assess the heart rate. So if there is no heart rate and there is no respiratory rate means there will be a priority 1. Suppose respiratory rate is there, heart rate is less than 100 means then it goes to the priority 2. So by assessing this one only, we are giving priority to the patient, that is 1, 2, 3 and dead. So 1 means immediate, 2 means also is immediate, and 3 means it is little minimal. We can delay for 2-3 minutes and then dead. So this is about the how we are prioritizing in this one. So this symbol looks like a cross, and also it is a cross only. So here priority 1 is critical, that is red in color, immediately we have to shift. Priority 2 is serious, and then priority 3 is minor injuries, and then dead. So here we have to assess, this will be the patient name and their vitals, and the what drug is given, name and dose, and by whom it is given. We have to fill this form. And then categories of triage. So here there are 5 categories are there. So one is the category 1, and then category 2, 3, 4, 5. And then category 1 will be the immediate one, like we should give resuscitation. For example, patient is having heart attack, major car accident means immediately within seconds we have to give the CPR, resuscitation. So that is category 1. So category 2 is we have to start the treatment within 10 minutes. The deadline will be the maximum time is 10. Within 10 minutes you have to start the treatment in category 2. So here severe blood loss will be there and overdose will be there. And category 3, it is very urgent. So for example, head injury, patient is conscious, breathing difficulty will be there and infection. So deadline will be within 30 minutes you have to initiate the treatment. Whereas category 4 is semi-urgent, and for example, sprained ankle with possible fracture and eye inflammation. So here the deadline will be within 1 hour. And last one will be category 5, that is non-urgent. Here the example is cut not recurring stitches and common cold. So this will be the not urgent. So this is the 5 categories of triage system. And next will be the levels of triage. So here there are 5 levels will be there, and also it is equal to category. So there will be a level 1 means immediate life threatening, level 2 means emergency, could become, suppose you didn't give treatment in this stage, they will become life threatening. And then level 3 is urgent, so not life threatening. Level 4 is semi-urgent, this is also not life threatening. And then level 5 is non-urgent, needs treatment when time permits. It's coming to the end. So this is will be explaining the whole triage system. For example, suppose patient is enters here. This is the whole topic will conclude with this picture. Let us begin that one. Here is a disaster situation. Patient is lying down here. It's a medical person's disaster management team have arrived. So now patient is entering into the triage system. So here we know there are 4 categories are there. First, we have to assess whether it is immediate care or delayed care. So the red color shows immediate care, the yellow color shows delayed care. So now patient enters into the triage, and then he can go for immediate also, or he can go for delayed care also. So if it is a delayed care means they will go to the casualty and collection point. And if patient falls under the category of immediate means, definitely immediately patient will shift to the hospital. So now coming to the level 3, that is the patient can able to walk and there is a minor injuries. That is patient can walk but there will be a wounded will be there. And last one will be the, that is not emergency, but we should keep it in mind, and the patient is dead. So here the color, red color is immediate, and yellow color is delayed care, and then green color is not urgent, and then dead. So these are the whole entire triage system. Here the picture shows. So here to conclude my topic, here so far we have discussed about the little introduction about the disaster and how the disaster management act had come in India level, and the chairperson will be our Prime Minister of India, along with the 9 members will be there for 5 years, and their major functions is guideline and then policy making and acting. This is about the NDMA. So next we saw about the disaster cycle and phases of disaster and disaster management. So under the disaster management, the important thing is preparedness, as well as response, recovery, as well as the response team. So 4 phases will be there. So the important aspect of the disaster management is also a triage. So triage is nothing. We are just giving priority to the patient. We are categorizing the patient according to the priority. So those who need more care, like life-threatening means we should give them color like a red color, and we should give immediate CPR and resuscitation we are giving. And then if it is a yellow color, delayed care, and then green color, no issues, not urgent, and the black color will be the this. So these are all the system. Even India we follow even now also. So here to conclude my topic, so worldwide we are facing the global biological threatening disaster, that is the COVID-19. So here the same management things can be applicable for the COVID-19 also. Hope you are all understand my topic about the disaster management as well as about the triage system. So let us see in next video. Thank you all.